And joining us here in the studio without the mask is orthopedic surgeon Dr. Stephen Zabinski and the real star of the show, so to speak, patient Rita Davis. Rita, Dr. Zabinski, nice to have you with us.
Thank you.
Let's start with the doctor. Stephen, Rita's obviously doing well. We'll ask Rita, but why don't as many people have shoulder surgeries as knees and hips and so forth? Why is it relatively rare?
The answer to that probably is that we don't walk on our arms. The large weight-bearing joints of our legs, our hips and knees, are much more commonly replaced because of osteoarthritis, which is wear and tear. Wear and tear in the shoulder more often involves not the actual joint, but the rotator cuff tendon. So we see a lot more problems with rotator cuff tendons from lifting, but because they don't have the weight-bearing force, the cartilage doesn't wear away. There are, however, approximately 5 to 10% of joint replacements that are done that are shoulder replacements for either conditions of the bone, such as Rita had, or for osteoarthritis.
Rita, big question. How you doing? It's been a month.
We're doing great. We really are doing well. I'm able to do a lot of movement with my arm, and
wow.
You know, with physical therapy, it's helped a whole lot, and you know, we're coming along. We're mending and we're coming along.
So in terms of the pain, you know, you got some stiffness, but other than that?
Still have some stiffness, still have a little bit of pain, you know, every now and then with the physical therapy, because they really work the arm, and you know, to get it with good mobility and everything. So, but we're doing great.
That's great. And you had the other shoulder done a year or so ago, so you're the true bionic woman.
I am, and even had a hip replacement done by Dr. Zabinski.
Wow.
So we're really doing
endorsement.
Good. Yeah.
When does a person know that they need a shoulder replacement, Steve?
They're going to have pain and some loss of motion. The most common things people notice, they're having trouble getting to their back pocket to get their wallet out. They start to get pain at night if they lay on the arm in particular, or they'll, in this outstretched position, have pain when they reach for something, or reaching behind them. People come in and say, I'm reaching behind me in the car and I have pain. And a separate issue, a little plug for physical therapy. A key part of recovering from shoulder surgery is physical therapy, and it's vital to the whole process. It's not just what we do in the operating room, it's having the right patient, and it's having that patient willing to work with the therapist to get the recovery that they need.
Rita, if someone's considering shoulder surgery, what advice would you give them?
I would advise them to call Dr. Stephen Zabinski. And if you are having a lot of pain and you don't understand really what's going on, really seek out a doctor to find out what's happening in there. So, because you could be in some pain and not know and think it's one thing, and you know, it could be something, you know, even more serious. So, seek out, you know, a physician's you know, help about it and advice about it. Yeah.
That's great. Well, it's great to see you. Congratulations.
Thank you.
You know, continued recovery,
Thank
obviously.
you.
And stick around. We might have a few more questions. But Dr. Zabinski, go check with your doctor. Make sure it's not just muscular, and it could be a degenerative disease or joint.
Absolutely. And shoulder conditions, actually, interestingly, can be coming from other problems. I have people who come to see me with shoulder pain. It's from their neck. Or less commonly, it can be from a condition affecting the lungs, or even affecting the abdomen. So it's important to keep that in mind too with shoulder pain. Start with your local physician, your primary physician, and then you may end up in an orthopedic office. It's nice of Rita to say may, but end up with an orthopedic surgeon who has a particular expertise in shoulders. That's important as well, that it's a physician who knows a great deal about the shoulder, because it is a complicated joint, as we saw on the video.
Yeah, well, it's great, and great to see you doing so well.
Thanks.
So thanks for coming on and being our guest, and thank you, Dr. Zabinski.